Sundaram Business Services presents Humanizing Technology, hosted by Sri Ram Iyer. Hello and welcome to Humanizing Technology. Humanizing Technology is a podcast series by Sundaram Business Services that seeks to connect humans through technology, whilst discussing the latest trends and impacts on our lives. Today, we are going to have the spotlight on a specific industry, the healthcare industry. We're going to look at how the healthcare industry is innovating in the midst of this crisis. I'm really thrilled about today's edition because we will be speaking to one of the original digital health leaders in Australia who continues to provide health advisory services to the health industry. He also chairs CSIRO's eHealth Research Centre. Please join me in welcoming Richard Royle. Richard, a very warm welcome to Humanizing Technology. How are you doing?
I'm doing well, thank you, Sri Ram, in these interesting pandemic times.
Absolutely. And look, it is a privilege to have you on our show. We're really grateful for you that you made time to be part of this podcast.
Not at all. No, I look forward to having this conversation with you.
Excellent. Richard, let's get right into it. You've had extensive experience in the healthcare industry, but how did it all begin? How did you first enter the healthcare space?
Yes, well, I've been in the industry quite some time. It was during my master's degree in health management that I actually started working at Royal North Shore Hospital in Sydney with the deputy CEO of that hospital at the time, who actually went on to become the CEO of the largest private hospital group in Australia,
wow.
Main Health. But that fellow encouraged me to work through various aspects of health management, through human resources and medical admin and finance and non-clinical areas. And he continued to mentor me through my formative years, which actually assisted me greatly. And it would probably not surprise you, therefore, that I've been a strong supporter of mentoring, and I mentor a number of people in the industry. Anyway, I ended up becoming the CEO of a regional health service in country Victoria at the age of 27, and
wow.
I've essentially been the CEO of hospitals ever since.
Excellent. Look, that's a wonderful journey, and we know how deeply entrenched you are in the healthcare industry, which brings me to the next question. What does this industry face in terms of its biggest challenges?
Well, health's an interesting profession. It's quite closed as an industry, and the industry itself is not reticent to change, quite the contrary, but managing change is one of the biggest challenges in the healthcare sector. At the end of the day, the healthcare sector deals with human lives. So quite rightly, clinicians want to make sure that whatever they're doing is going to improve the outcome for their patients. So the biggest challenges in health today, in my view, is managing change. The digitisation in healthcare has come comparatively late to this sector, and the pandemic has actually turbocharged this. And digital health implementation and growth is actually all about change management. So that's a particular challenge. Another significant challenge in the present time is maintaining an educated and well-trained workforce. Because of the nature of the business, health will always be a human-intensive industry. And the challenge is actually to remain as an attractive employer to not only retain but to grow your staff. So how you do that is a significant challenge, particularly in the current era of digitisation, which leads me to the third challenge, which is actually keeping up with technological change. Health's interesting in that it's always promoted technical improvements and technology improvements because that's the nature of healthcare.
Sure.
Digitisation has brought another layer to it. So managing that process is also quite critical.
Indeed. Look, we'll speak about digitization of healthcare and the challenges presented by COVID-19 as well. But how does a healthcare organization overcome these challenges? What should they be doing?
Well, it's not rocket science in terms of change, in terms of managing this. It does come down to some fundamentals, and one of those fundamentals is strong leadership. And strong leadership that has the mechanisms to not only identify the technology that will have significant impacts on the health industry, but to actually quickly adapt to that technology, to embrace it, to identify the change champions, to assist in that process of implementation of the technology, and to show clear leadership. So that's one of the important ingredients of this.
Yeah.
Another really important ingredient which goes with leadership is about strong communication. Remember, this is a very human-intensive industry, and it's important that when you are a frontline worker in healthcare, that you are communicating well with your patients. The same applies across the health industry and within the health industry. So it's really critical that leaders continue to keep their people fully informed on what is happening, why it's happening, and how staff can assist with the changes that are required. And my third point I'd make here is the need for some really strong engagement with clinical leaders in the health space to ensure that they can actually embrace and support the change. Because the clinicians themselves, whether they're nurses or doctors or anybody with frontline hands-on working with people who are sick, it's actually their voice is really important in the eyes of the community, who highly respect clinical people. So getting them engaged in the technological change is also pretty fundamental to success.
Absolutely, absolutely. So let us look, any discussion, any podcast specifically is incomplete without speaking about COVID-19. And you did mention that. Now, it's impacted every sector. We know that, especially healthcare. But so how are you seeing healthcare businesses coping with the impacts of the pandemic specifically?
Well, the first point I'd make is that we're talking in Australia, and Australia very fortuitously hasn't had as great an impact on its healthcare system as many countries have. There has not been, not to date anyway, a major surge in hospital activity linked to the pandemic. So, but of course there was an enormous amount of planning and continues to be a lot of planning. In essence, the Australian healthcare system is actually coping well. It's shown great flexibility in adapting quickly to the changing circumstances. Health systems had to ramp up emergency department staffing. It's had to increase resourcing requirements in key clinical areas such as intensive care and respiratory units. It's had to close and open elective surgical operating lists. It's had to incorporate increased telehealth requirements, which of course has become almost the norm these days as a result of the pandemic. That's led to the need for health services to improve their IT hardware to cope with increased demand for digital usage. So in essence, there's been some quite quick adapting, but the health system has actually managed really well in Australia, and I think it's a great credit to the leaders in the industry.
Absolutely. There has been numerous examples of exemplary leadership from healthcare, and it is good to see. But some believe that this pandemic might never end. We might be in a permanent pandemic, is a school of thought. Look, it has
I actually have a different view to that.
Yes,
it's an ongoing issue. I have the privilege of chairing the CSIRO's eHealth Research Centre, and I'm on their Health and Biosecurity Committee.
Yeah.
And of course, the CSIRO did the platforming work for the AstraZeneca vaccine. And so I think there is a process of significant ramp up of people in the world to get vaccinated, and we're all seeing the media about that. But ultimately, it will become a safer environment. It's just going to take a damn sight longer time than we all thought.
Absolutely, indeed. And whilst it is here, it is going to severely test our resilience. We know that. How should, you spoke about leadership, and they've been doing a great job. Absolutely, no doubt about that. How should healthcare leaders ensure that their business models and business processes remain resilient and relevant?
Yeah, look, that's an interesting question. And of course, I had the fortuitous opportunity to develop the country's first fully digital hospital back in 2014. It opened, and so given that I've been involved heavily in the digital health space in Australia for some time, I'd have to say one of the great requirements they have, which they are doing, of course, is increasing their focus on digital capabilities. Because in so doing, that actually makes transformation and rapid change a little easier to enact. Fortuitously, the advent of cloud capability has increased that opportunity and that ease. Nevertheless, having a digital framework to assist in these times of rapid change is, I think, fairly critical. And that requires leaders to ensure that their IT hardware and their cybersecurity regimes are up to standard. And it also requires them to focus on further improving the interoperability between software systems, because it's the engaging of the information flow between the various systems in healthcare, which has been one of the fundamental problems in the health industry. That's around the world and certainly in Australia. And getting interoperability to allow the critical data to be shown in real time to allow them to efficiently manage their services, particularly when they're under pressure in the likes of pandemics, is critical to maintaining their efficiencies to get their hospitals running properly.
Indeed. So look, I mean, it is obvious that going forward, digitization is here to stay and is something that hospitals will need to tap into. How are you seeing it playing out in today's world? Are you seeing automation, for example, be at the forefront for digital transformation? What are you seeing happening in today's world?
Well, the first thing I'd say is health's always under the pump. Always under the pump in terms of financial demands. Activity always outstrips what you're resourced for, and there's increasing costs always above revenue levels. So managing health systems has always been very challenging and is increasingly challenging as a result of technology improvements, because you always need to be at the forefront of technology change in order to keep up with the industry. That's really hard. So in my view, health leaders need to make the conscious decision to actually increase their investment of their scarce resources in the digital improvements. Some leaders in Australia have actually done this well, and some state governments have allocated increased resources to it. And they become digital change champions, which I've historically been, and they need to demonstrate to the broader health industry that further investment in digital programs and in resourcing the staff and the education for those staff around those changes can actually lead to significant improvements in digital health, in the healthcare of people. You know, whether it's improved clinical outcomes for patients, whether it's increased operational efficiencies, whether it's improved data to assist in the rapid decision making. These are all outflows of really well implemented digital change in the health industry. Yes, it's progressing, but it's progressing comparatively slowly, but has been now put on the turbocharge as a result of what's happened with the pandemic, which is ironic because if I think back, I led the review for the national government in Australia that set up the personalised My Health record. And I was banging on about it in 2013 and 14 about the importance of investing further in digital health. And it's taken a global pandemic to actually push that button big time.
Indeed.
So it's delightful for me to see.
It is. And as unfortunate as that is, it is somehow, it is the way the world operates on some levels. Okay, look, I mean, you've had a wonderful journey, and you said that you oversaw the successful implementation of Australia's first fully integrated digital hospital. I'm going to give you a crystal ball because as the visionary of digital health in Australia, I would like you to look into Richard Royle's crystal ball and tell us over the next, say, 5 years, what does the future hold for digital health in Australia? What do you see happening in, say, 2026?
Look, I think the future is very bright. I have a personal desire to see increased engagement with consumers in healthcare. From my own work, and when I did the review for the federal government that set up the My Health Record, it's very evident to me in all my engagements that people very much want to know more information about their own health. And the digital frameworks now allow that to happen increasingly so. And so, it's not surprising that the community have been delighted with the opportunities to see their doctor over the computer or on the phone, rather than having to see them in person. It's revolutionised around healthcare. So I think there are a number of opportunities for significant improvement and change, and one of those is going to be increased engagement directly with the consumer, who are actually hungry for this. And that's not just in a telehealth space. There are increasing number of technologies that can actually help you with diagnosing some illnesses in your own home and link directly over the internet to your doctor. A lot of those have been already well established in countries such as Israel and the United States. And those sort of opportunities for direct engagement, I think, are going to start to ramp up big time. Because what I've found really interesting in this pandemic is that people have taken to the digital concepts of health very quickly. And Australians do that generally. They certainly have in this country. So I think there's going to be a consumer demand for increasing that technology uptake. There's going to be increased innovation in both the clinical and the administrative space. And when you talk with clinical leaders, a lot of the upcoming younger clinicians who are becoming leaders very quickly in the clinical space are, of course, very adept to the technology and the digital side of things. So they're starting to lead much more strongly to say, why can't we do things in a more digital way? So I think they're going to be a fairly significant turbocharger as well. And governments are having to respond to that financially because that's the demand. So I think the future is very bright. Clearly, given that you're dealing with people's lives, you need to do it in a very safe and measured and researched way. But in fairness, we've done that in this country very well to date. We'll continue to do that. So I'm delighted with where things are going, to be honest.
Well, that is really good to hear from one of the pioneers of digital health in Australia. For you to say that the future is bright and that you're delighted, well, that spreads a lot of optimism, much needed optimism in today's climate. So, Richard, look, thank you so much for joining us. We are honored that you could spare the time to run this podcast with us. It has been a personal pleasure and a privilege to have you on the show. And thanks for sharing all these wonderful insights.
No problems. Thanks very much, Sriram. I love the opportunity to talk about something I'm very passionate about.